concern about their day-to-day logistics and also the caterings and all the other different aspects of the people's work. And during this battle against COVID-19, our medical workers is fighting at the front line, and we have 140 billion people standing back for them. And this spirit of tying the people together with the medical workers is actually the result. The reason for we have achieved such a good result. Currently, the COVID-19 is under very good control in China, but we should not neglect the risk posed by COVID-19. By the 18th of the April, and for a consecutive 49 days, we have imported cases. The current imported cases is over 200. And we also have the outbreak of COVID-19 cases in China scattered around this country. Currently, we are dealing with the second wave of COVID-19 with the autumn arrives. So we should always uphold the importance to protect our people against COVID-19, and we should detect any sources of the COVID-19. For today's press conference, the theme we are going to introduce you is about the prevention and control of COVID-19 in the coming winter and fall, and also the functions, the roles of the medical workers played during the battle of COVID-19. Today, we are really honored to invite Mr. Tong Zhaohui, who is the Deputy Director of the Beijing Changyang Hospital, and also Mr. Wu Zunyu, the Chief Scientist of the CDC in the infectious disease, and Director Wu Hao, the Deputy Director of Beijing Fangzhuang Community Hospital. And today we are really also honored to invite the General Monitor Commissioner, Madam and we invited the representative of the grassroots doctors and also Director Wu Hao, who is also the director of the Beijing Fangzhuang Community Hospital. And today we are also really honored to invite Monitoring Commissioner Madam Wang Bing from the China Health Commission, Disease Control Center, and also Commissioner Guo Yanhong from the Medical Governance Bureau. So we are going to invite them to answer all of your questions. First, we'd like to give the floor to Madam Wang Bing to give you a general introduction of the current situations. Dear friends from the press, COVID-19 outbreak is actually the fastest spread disease with the widest coverage since the foundings of the People's Republic of China. And during the prevention and control of COVID-19, the public health system across the nation has upheld the spirit granted by the CPC Central Committees, and we are working on a generalized mechanism against COVID-19 outbreak. And we have launched several different works, included, first, we have perfected our prevention and control plans for the COVID-19 and provided a scientific guideline for COVID-19. During our general practice, we have tried to summarize the rules behind the COVID-19 outbreak, and also with targeting the sensitive group of people, the public spaces, we have launched 15 different general plans, and we have also given 6 different plans and guidelines supporting the mental effort, and we have also drafted over 60 different general guidelines. This has greatly improved the precision of the COVID-19 outbreak. Second, we have also provided reference for the COVID-19 with our general guideline. We have closely followed the status quo of the COVID-19 outbreak in China and also abroad. We believe that the general public is at the heart of all the policies that we made. Fourthly, we have controlled the spreading sources. where there is a COVID-19 outbreak, we'll see the disease control commissioners playing at the front line. And they have worked at the front line to do the epidemiological research, conducting PCR testings, and also tracing back the close contact. By the end of the 18th August, currently we have traced back to over 800,000 people, and we have also cleaned the environment to create a safe and reassuring environment for the general public. 6. We are also working on advertising and promoting the health lifestyles. All of the disease control centers, no matter which level they are working on, they have led the general public to have a correct understanding of COVID-19 and promoted the prevention control method, including wearing masks, wash hands frequently, less gathering up, and this has greatly improved the general public's awareness of the infectious disease. Fifthly, we are also working on the mental health of the general public. During the COVID-19 outbreak, we have formed up all kinds of the mental supporting plans and also the working manuals for the experts across the whole countries. Based on the previous hotlines for the mental support, we added newly 673 different hotlines. And this is actually helping us to maintain the mental health of the general public. 6. We are also working on a national mechanism of the fight against COVID-19. By strengthening up the national effort against COVID-19, we have dispatched to Hubei, Jilin, Heilongjiang, Beijing, and Xinjiang all kinds of the expert teams. And with the teams focusing on the on-site research, mental support, epidemiological report, we have curbed the spread of the COVID-19, especially in the battle of Hubei and Wuhan. We selected over 1,000 public health commissioners to help Hubei, and this is a team formed by the PCR testings, epidemiological researchers, nutritionists, among other different experts. They have arrived at Hubei at the first stage and they leave Hubei last. They have finished over 30,000 epidemiological research with researching into over 40,000 close contact, and they have actually checked around 440 different samples. And this is also a very important laying the foundations for the battle against COVID-19 in Hubei and in Wuhan. For this real-time practice of the battle against COVID-19, it actually let us to rethink about the rules of the CPC central committees, and also it helps us to accumulate sufficient experience. For example, we believe the community is also a part of the front line, and we should also care about the epidemiological research, and we believe that 2 hours, 12 hours, and 24 hours are threshold for the spreading of COVID-19. We should also focusing on the key areas, key populations, and also the key cities. And we believe the early detections, reportings, treatment, and prevention is also very important. And we should also care about the 4 groups of people, for the suspected groups, confirmed groups, and also the imported people. So with all these measures came into effect, and all of these requirements of these measures, withstanding the testings of the battles, they are playing a key role in the battle against COVID-19. In this war with no blood, all of the disease control commissioners is playing their full roles, and they are winning the battle over COVID-19 with their full spirit. They are being testified in their previous effort, and they are showing and demonstrating their spirit with their skills, masterminded. And I believe as a disease control commissioners, we believe that we have fulfilled all kinds of missions granted by the party and also the nations. We believe the result is quite satisfying. Thank you. Here we like to give the floor to Madam Guo Yanhong to give us a brief introduction. Dear friends from media, good afternoon. The year of 2020 sees all kinds of the ups and downs, and we believe this year's festival marks a very meaningful day. So before the eve of today, General Secretary Xi Jinping is sending a national greetings to all the medical workers. And he also emphasizes that all of our medicals is paying a great effort in the battle against COVID-19, and they are contributing a fair share to the winnings of the COVID-19. The medics, doctors, and also the medical workers is greatly inspired by his remarks. This year, facing the unprecedented COVID-19 outbreak, the medics has remembered the missions granted by the party and also our general public. They were fighting at the front line of COVID-19, and they have also protected our general public from the spread of the virus. To fully spread their spirit during this battle against COVID-19 and to fully demonstrate their effort to protect the whole nations, we have also want to inspire the medical workers to contribute a new fair shares in the coming areas. The National Health Commissions is working together with all kinds of the relevant institutions, creating a motto for this year's festival as spreading the spirit of the medics. And we have required all kinds of the institutions, mechanisms, and also the local governments to spread the spirit of the medical workers who is fighting at the front line of COVID-19. We believe that with all of our efforts, we are not only going to win the battle against COVID-19 at all kinds of levels and all tiers, we are at the same time, we are also going to finish the general day-to-day work of our medical workers. We have required different local hospitals and local governments to use this festival as an opportunity to spread the spirit of the battle against COVID-19. And we believe that we are determined to win the battle against COVID-19. We are not going to relax ourselves for one moment. And we are also going to consolidate the result for the prevention and control. This has greatly inspired the medical workers to keep their spirit until they win the final result of COVID-19. And secondly, we believe a good team building is very important. We should care about the medical workers. As General Secretary Xi Jinping has emphasized once again, the medical workers is the major pillars supporting us against the battle of COVID-19. We should care about them, protect about them. After this outbreak of COVID-19, after this battle of prevention and control, it once again consolidated the role of the medical workers in protecting the health of the general public and in protecting the health of the whole nations. Thus, it is very important to breed up a team of the medical workers with good skills and good moral spirit. We must prioritize the educations of the medical workers in the more important positions, and we must understand this is a more important tasks. We required all the local governments to care about the medical workers and to adopt a more preferable measures to guarantee their salaries, growing up spaces, and also training opportunities for all of them, creating better workspace environment for all of them. We are also going to build an honorary mechanism for medical workers. Third, we are going to promote the idea and the spirit of COVID-19 at a wider range. All the medical workers, they are not only working at a different front line of COVID-19. They were willing to sacrifice their lives and risk all kinds of the dangers facing this unprecedented disease. And also in their day-to-day effort, they are using a big heart to love the general public and provide the detailed treatment for every single patient. So we are not only going to thank all the medical workers and also the institutions, communities who were leading the national battle against COVID-19, we are also going to give our respect to medical workers in our day-to-day practice. And we should set up the examples. And this is going to greatly encourage the medical workers to once again understand their missions, and they are going to better safeguard the health of the nation. We are also going to promote the whole society to respect the doctors, respect the nurses, and respect the medics. This is equivalent to the respect of life. We should also enhance the awareness of the general society support to the medical workers. We believe that the respect for the medical workers is a very good environment to share and enjoy the health. I want to thank the two commissioners for your kind introduction. Now the floor is open for questions. Please identify your institution before the questions. So we are going to invite the journalist on the third row. Thank you very much. With current news, we know that today celebrates the China Medical Festival. So my question is that after this battle of COVID-19, as a representative of the medical workers, what do you make of the spirit of the medical workers? How do you celebrate this festival with more meanings? We'd like to invite Mr. Tong Zhaohui to answer this question. Dear friends from media, good afternoon. Just as you mentioned, we believe that we are going to stick to the mottos of respect to life with our bigger heart. This is also at the heart of this year's China Medical Day. During this battle against COVID-19, thousands of the medical workers works at the front line. They were becoming the best image in this battle. So in these battles of COVID-19, the medical workers has gives us a quite satisfactory answers, and they should belong to the loveliest people in this new eras. They are the real resources of the nation, safeguarding the whole nation against unknown virus. And we are promoting the whole society to respect the nurses and doctors, and we should generalize the commissions to build a healthy China. And this is going to help us to build a harmonious relations between the medical workers and also the general public. The CPC Central Committee and the national governments cares about the medical workers and also our practical workplace environment. Under the current stage, not only about the special environment of the COVID-19 outbreak, we should work at our own positions, and we should also spread the idea of the battle against COVID-19 spirit while safeguarding the health of the general public. We should hone our skills, and we should safeguard our morals in our day-to-day practice. We believe that we are setting up examples across the whole society. Thank you. Next question, please. Thank you very much. With Hong Kong Zhongping News. This year marks the third China Medical Day. How many medical workers across the nation? What are their compositions in the recent years? What is the recent educational development for the medical workers? We'd like to invite Madam Guo Yanhong to answer your question. Thank you very much for your question. We all know that medical workers is safeguarding the national health, and they are also working as the pillars for the scientific and research of the medical world. So that is to say, the medical workers and doctors should be the major pillars across the nation. CPC Central Committees and also the State Council really cares about the healthy and educational development of the doctors. Especially after the 18th National Congress, we have developed a series of the systems to better cultivate the doctors, and also we have built up all kinds of the social mechanisms for them to get promoted, and this is emphasized once again by the CPC Central Committees. In the medical teams, these years we have made great improvements. First, we have an enlarging medical workforce. By the end of the 2019, the total populations of the medical workers is reaching 3.86 million people. That is around 830,000 people increase compared with the last year. That is around 80% increase. In the medical workforces, there are 57% of them graduated out of the college. The second part I want to introduce you is the medical workers working at the grassroots. While we are trying to emphasize the roles of the medical workers in the grassroots, in the recent years, the whole team has increased dramatically. At the end of the 2019, the total medical workers at the grassroots is 1.47 million people. That is a 34.4% increase compared with last year. So from this data, we could see the growth at the grass level is quicker compared with the general overall medical populations. Thirdly, we really care about the weak links or weak part of the medical team. For example, the psychiatrist and also the pediatrics. It has grown quite rapidly in the recent years. For example, the pediatrics. In the year 2019, the total practitioner is reaching 234,000 people. That is to say, the skills, capacities, and numbers of the medical team has improved steadily and greatly. The team of the medical practitioners is transferred from a high-speed growth to a high-quality growth. The medical workers, together with all the nations, they are working really hard effort to improve the national health. In the 2019, there are over 8.7 billion people. There are over 8.7 billion times medical consultants provided by the different institutions. From the inpatient department, the total inpatient numbers in the 2019 is 266 million. That is 54% growth compared with the previous years. So that is to say, from the general increase of the medical services provided to the public, the professional medical workers is providing an essential effort to improve the health of the general public. So we hope that going forward, with the efforts from all the institutions across the whole country, we are going to build a whole good medical workforces, and we are also going to serve the whole nation with better service. And we want the medical team to better serving the whole nation. Thank you very much. Next question, please. So with CCTV and CMG, in the opening remarks, Director Mi has introduced that in the coming autumn and winter, there is a greater possibilities for the spread of the coronavirus. What kind of effort or preparations did we do so far? We'd like to invite Madam Wang Bing to answer your question. The CPC Central Committees and State Councils cares about the preventions and controls of COVID-19 in the coming winter and fall. In the last June, we have upheld working mechanisms for the prevention and controls coming in the winter and the fall. And at the same day, the National Health Commission was spreading the spirit of the Vice Premier Sun Chunlan's fully preparations for the COVID-19 outbreak in the winter and in the autumn. So currently, we are working on several different fronts. First, we are trying to set up a regular mechanism dealing against COVID-19. Recently, we have printed and published the guideline of the environmental testings in the agriculture's seafood markets. And we have also printed out the general guidelines for the educational institutions covering the primary, middle schools, and also the high-level educational institutions about the testings and also prevention controls of the COVID-19. We have also printed out the prevention and control of the infectious disease for the adolescent. So with all of these requirements, it is actually giving a scientific reference to the different areas, including the agri markets and also schools, to have a rule to follow in the coming battle against the second wave of COVID-19. Second, we are trying to coordinate all kinds of financial efforts and also the central government's budget to enhance our capacities of the PCR testings. We have trained all the different personnel, and we have well prepared for the different medical professionals' beds while enhancing our capacities of the COVID-19. Thirdly, we are also working with all kinds of institutions to generate a new normal directive system against COVID-19. We should prevent the COVID-19, include both from the imported cases and domestic cases. We believe early detections and early control is going to be our regular measures against the coming COVID-19 outbreak. At the same time, we are also enhancing our PCR testing capacities. In the different regions, we are trying to make all kinds of the rehearsals. We are also trying to prepare all kinds of the inventories of the medical resources to be well prepared for the sudden outbreak of COVID-19. Today, we are also going to utilize this press conference to spread our ideas to all the friends from the media. Please help us in all kinds of activities to spread the ideas of the prevention and control of COVID-19, and we'd like to raise the awareness of the general public of COVID-19. Let us to stick to the wearing medical mask, wash our hands, with all the other different regular measures to protect us from COVID-19. With the general effort of the whole society, with the general effort of the governments, we are going to enhance the result that we have achieved so far. Thank you very much. Next question. Thank you very much. During this COVID-19 outbreak, the public health commissioners is actually caught up the light across the whole nation, we could see a difference between the work of the public health commissioners and also the clinical physicians. What kind of role did the public health commissioners play during this COVID-19 outbreak? What kind of role will these public health commissioners play in the future? Thank you very much for your concerns of the public health commissioners. So here I'd like to use these opportunities to say happy festivals to all of these public health commissioners. Public health commissioners is one of the 4 general clinical practitioners, and they are also the pillars for the public health in China. In 2019, the total numbers of the public health commissioners is actually 112,000 people. They are widely distributed in the professional disease control centers, grassroots hospital, communities, and also all kinds of the hospitals. And they are working on the different levels in the prevention and controls. So the difference with the public health commissioners and the clinical physicians is that the public health physicians is working at the general public. They are using a systematic preventative clinical knowledge and also to train the general public. And they are actually doing the prevention and the control at the front line. They are prescribing the treatment for the whole nation and for the whole populations. They are trying to improve the general health performance of the general populations. Although they share different duties with the clinical physicians, they are playing the public health physician is also playing a key role. For example, during this COVID-19 outbreak, the clinical physicians is treating the patient while the public health physicians is actually cut the spread of the disease and control the spread of the disease sources. We have some of the rules of the public health physicians in the prevention and control of COVID-19. It included that the public health physicians is actually the mind behind these tendencies of COVID-19. They can analyzing the future development of the infectious disease, and they can provide the scientific introductions and background information for the governments. Secondly, they are the testers at the front line. So when the COVID-19 is spread, the public health physicians is going to arrive at the front line. They could detect the epidemiological sources of the COVID-19. I believe that our general public, our people, has understood the public health commissioner's effort through the media's report. So they are working like Sherlock Holmes to understand, to find out what is the root of the COVID-19. And thirdly, they are also working at the prevention and control front line. They cut the spread of the disease, and they also giving all kinds of professional support to the cleaners and cleaning ladies. And fourthly, they are also working at the laboratories to testify the different cases and provided the reference for the enroll and discharge of the patient. Fifthly, they are ground-basing researchers. We all know that at the outbreak of the COVID-19, the public health physicians in the CDC has clarified the whole gene sequences of this coronavirus, and they have developed the PCR testing method. Sixthly, they are also the frontline warriors of the promotions of the awareness of the COVID-19. So the public health physicians is actually provided a wall for the general society. So just because of their efforts, we have achieved all kinds of the great momentums in the histories of the China's in the spread of the spread of the infectious disease, and we are calling for the whole nation's concern for the public health physicians. Thank you. Next question. Thank you very much. Xinhua News Agency. We all know that the COVID-19 is still quite rampant across the international society. I believe the prevention and control is still under huge pressure. What kind of measures should we take to stop the spread of the virus? We'd like to invite Professor Wu Zunyu to answer your question. Thank you very much for your question. Starting from March this year, the global trajectories of the COVID-19 is increasing rocketedly, and by the end of the May, the newly reported COVID-19 cases has break over 100,000 units. At the end of the July, every day we have reported over 200,000 cases. And globally speaking, the number is still on the rise. For the prevention and control of our country, we should prevent the imported cases. This is also one major part of our prevention and control of COVID-19. To do a good job in this part, we should follow and strictly control two thresholds. For one part, we should prevent the infected people to bring back the virus to our country. And second, we should also prevent the frozen food to be imported to our country. Without widely adaptations of the vaccines, the prevention and control of COVID-19 should be relying on the public health measures, wearing medical masks, wash your hands frequently, good ventilations, social distancing. So for one effort of the prevention and control of COVID-19, we should build a quite good alarming systems. Once the COVID-19 developed, we should detect them in the early stage. So what kind of a requirement in this system should be? We should have three different requirements. Firstly, for the patient, if a patient is demonstrating different symptoms including fever and shortness of breath, they should be enrolled in the hospital in a timely manner. It should not be postponed. Once it is postponed, it is also going to affect the development of COVID-19. Secondly, for the grassroots community hospitals and clinics, if we are detecting the first cases, the medical institutions should have the ability to diagnose the patient as a COVID-19 patient. Thirdly, our disease prevention and control institutions, since the outbreak of the COVID-19, they should find the potential resources for this contagious disease, and they should understand and detect the whole coverage of this disease. We understand that as long as we have detected the COVID-19 outbreak at the first hand, we can control the COVID-19. So I believe a sensitive alarming system is one of the important measures we adopted for the spread and control of COVID-19. Thank you very much. Next question, please. Thank you very much. During this battle against COVID-19, what kind of role did the grassroots hospital shoulder? So how do we better play their role in the coming prevention and control of COVID-19? How do we better enhance their capacities in the future? We'd like to invite Mr. Wu Hao to answer your question. Thank you very much for your question. after the outbreak of COVID-19, we understand that there are 4 million medical workers working at a quite unique front line of the COVID-19. They are working at the community. They did not become the headline busters, but they were closest to the general public. They are not the shining person, but they have warmed up the whole society. They have protected the elderly people and also the young people as the warriors protecting our different communities. They have finished their day-to-day diagnosis and also the PCR testings at different households, especially in the worst time. They have go into the community levels, no matter in the nights of the snow and also under the severe and chilling sunshine. They are going to the different households for the promotions and also promotions of the awareness of the COVID-19. They have also dispatched vegetables, food, and medicines to the different households. They work from dawn to dusk. They are actually playing a role as the general physicians to safeguard every single household. We all know that the community level prevention and control is the first and the last front line of a COVID-19 outbreak. So during this battle against COVID-19, they have done a really good job in rooting out all kinds of the risky persons, and they are also working at the early detections, early transfers, diagnosis, and treatment of the patient. The testing tools and testing physicians is also working to exclude all kinds of the potential risk, including the Xinfadi markets. In Beijing, the medical physicians is working under the sunshine to do the PCR testings for thousands of the citizens. They are not only collecting samples in the collective points and positions, they have also goes to every single different households. And in the Fangzhuang district of Beijing, we have collected over 200,000 people. And at the different communities, we are also shouldering a very important rules. We have quarantine different citizens, and all of these community level physicians is not only providing PCR testing for these citizens, they are also monitor these citizens. Sometimes they staying at our center for 2 to 3 months. That is the reason why they feel quite assured. In the future, we should focus on our effort on different fronts. We should fully play the role of the grassroots hospitals as the alarming positions. Early detection, the task of early detection should be rested upon them. We should also eliminate the possibilities for the patient to gather at generalized and comprehensive hospital. We should also work hand in hand with the public. We should also work together with the community level volunteers to educate the local citizens and their general day-to-day awareness of the prevention and control of the infectious disease. We have also provided the telemedicine conference to the different residents to provide it for the reliable medical consultancies. Thank you very much. Next question. Thank you very much. As Director Wu Ha has mentioned, the grassroots medical workers is contributing a huge share in the medical workforce after the battle against COVID-19. My question is that how will we improve the working ethics or working passions for the grassroots level medical workers? We'd like to invite Mr. Wu Hao to answer your question. Thank you very much for your question. I think that question should be answered at the different fronts. First, we should enhance our policy support. We should stabilize the workforce at the different grassroots hospital levels, improve their working qualities, and we should also guide the media to better report the image of the grassroots hospitals. And for the grassroots hospital practitioners and also grassroots medics, they should improve their sense of values. They should work at a better work ethic. They should also improve the general public health awareness for the grassroots, and I believe that they are going to become the general physicians for the grassroots. They are also going to serve the general public at a better situation. When the wind is harsh, we are going to understand the toughness of the plants and also the trees. So here I'm calling for the whole society understandings of the grassroots hospitals and medical practitioners to let them be better understood across the whole country. Let them feel the warmth of the whole country. Next question, please. Thank you very much. With China Daily. During this battle against COVID-19, we believe the patient under severe and even critical conditions is quite worrying. So what kind of effort did we made to improve the situations of the severe and critical patient? We'd like to invite Madam Guo Yanhong to answer your question. Thank you very much. Indeed, during this treatment of the COVID-19 patient, the treatment to severe and critical patient is critical to improve the survival ratios. The treatment of the severe patient should be based on the two different areas. And I believe that we have features includes. First, we have enhances the early treatment of the COVID-19 patient. Early detection, early report, early discovery is quite important. This has moved the threshold for the patient at the early stage. For the mild patient, we conducted a close medical monitoring for all of them, and we have adopted a series of the intervention measures, preventing the patient from getting worse. These are the measures that we have taken to lower down the total patient numbers of the severe group. Secondly, we have also focusing on the 4 different fronts. We have gather up the patient, gather up the experts, gather up all kinds of the medical sources, and in the battle of Hubei and Wuhan, we have mobilized the best doctors and nurses across the whole countries, the best medical equipments across the whole country. In Heilongjiang, Jilin, and Urumqi, and also Dalian, we arranged national level experts, and we have also supported the provincial medical experts, especially for the patient in a severe and critical stage. For example, Professor Tong Zhaohui has been working in the different cities, fighting at a different front line. He is a member of the national expert team. And in the treatment of the severe patient, we are not only focusing on the 4 fronts, and we have also combining the 5 different practices. We have combined the basic medicines with the clinical practitioners. We have also enhanced our researches into the basic research for the virology and also the pathogens for the virus. This has provided reference for the clinical research. It is also provided a more precise target in the clinical treatment. Secondly, we have also enhanced the early stage treatment with the multiple discipline support. At the backdrop, we all know that for the patient at the severe and critical stage of COVID-19, they are in an elderly age group with underlying comorbidities and multiple organ failures. In the treatment of all of these patients, we need a cross-discipline medical supporting team to provide a tailor-made treatment for this patient. Thirdly, we are also combining the medical treatment together with the nurses, so the COVID-19 patient is quarantined with no cares from the families. All of the basic nursing and also the practices in all of the nursing and the day-to-day cares is provided by the nurses. For the 4.2 million people supporting the Hubei and Wuhan, over 70% of them are nurses. This has proved once again the importance of the nursing. Fourthly, we have emphasized the importance of the medical governance. We actually want to provide the homogeneous and standardized medical treatment for the patient. We have built up the mechanism for the tailor-made ICU patients, deceased patients, to discuss each of their situations. This has helped us with our homogeneous treatment. Fifthly, we have also combined the traditional Chinese medicine with the Western medicine. While we were summing up all kinds of the experiences, today we understand that we have released the 8th treatment guidelines for COVID-19. While we were trying to sum up the clinical experience for the COVID-19, we have also optimized our prevention and control for the COVID-19. This is going to make a comprehensive, precise treatment guideline for the COVID-19 patient. This has also provided a framework for the clinical practitioners. For the past 4 months, the enrolled patients have claimed no deaths. This has testified once again that our experience and strategies is demonstrating its result, and we believe our precious experience is also included in the 8th guideline of our practice. So for the interest of time, we are only allowed for the last 2 questions. From the People's Daily, some of the people worries that there's another wave of a COVID-19 outbreak in this autumn and winter. How do we prevent this second wave of COVID-19? Thank you very much for your question. The end of the autumn and the beginnings of the winters, and also the end of the winter, the beginning of the spring is the time and also the period where the respiratory disease occurred frequently. So people are worried, will the coronavirus come back to us? I believe that as long as a single case of the COVID-19 occurred, once again, there is a possibility for a second wave. I think there is a possibility for the second wave. But the scale of the second wave is being decided by whether we can detect the spread of the virus in the early stage. Actually, the COVID-19 virus the SARS-CoV-2 virus might come back at any time. Of course, when the winter comes, other different respiratory diseases will make the situations and also the preventions of the COVID-19 more complicated. We are very optimistic and confident in the prevention and control of the second wave of COVID-19. That is to say, it is not going to repeat the situations of Wuhan at the beginning of this year. The reason for my assurance is based on two facts. First, in January and February, during the COVID-19 outbreak in Wuhan, there are so many people migrated back from Wuhan to their own hometown. Their cases is being exported to over 30 different provinces. With proper measures of control and prevention, there is no single province is demonstrating over 2,000 cases. For the 30 different provinces, there are only 4 of the provinces have over 1,000 COVID-19 confirmed cases. The second facts I want to talk to you and introduce you is that in April and May in the northeast China, there is an imported outbreak of COVID-19, and in June, in Beijing, originated from the Xinhuadi markets, we have another wave of COVID-19. In July, in Dalian and Urumqi, there is another outbreak of COVID-19. For these different outbreak of COVID-19, it has been stopped by our early detection and sufficient control. This has helped us to early detect and eliminate the SARS-CoV-2 virus. We have 3 reminders to the general public. We should keep our awareness of COVID-19. Secondly, we should stick to the measures of the prevention and control. Wash your hands frequently. Please wear a facial mask when you are in a bad ventilated places. Thirdly, and the most important one, once you have different symptoms including the sharpness of breath, headache, and fever, please get to the hospital as quickly as possible. This is very helpful for the patient themselves, and this is also very helpful for the disease control and prevention center. Thank you. Final question. Thank you very much. With China Xinmin News, last month, the college entrance examinations has been finished, and the college student is actually signing up for their future majors. So I want to ask different representatives, are you going to encourage the college graduates to choose medicine or medical as their professions? What are you going to say to all the students? We'd like to invite Professor Tong Zhaohui to answer your question. Thank you very much for your question. This is actually a very good question. It is also about the future of our nation. We have always talked about when we were getting old, who's going to treat for us? I think we care about this question. Generation after generation, we need good doctors to treat us. We warmly welcome all the students with a devoted spirit to choose medicine as a major. We all know that the medical schools every year, it has enrolled a lot of students, and the students were facing a lot of fierce competitions, and they have several years longer education period than other different majors. We hope that after a long time education, these students would be a part of our medical workforce. I also hope more medical students to echo back with the call of the CPC Central Committees and also the State Council to devote themselves when the nation and the general public need them, to contribute their efforts to the health of the general public and the future of the nation. In medical schools, you will learn a quite enriching medical knowledge and clinical practitioner skills, and you should also care about the knowledge of the general public and all the informations. I hope the medical student should be a comprehensive developed student. We all know the medical student is a very professional and high demanding major. Medical student learns sociology, art, economy, laws, among other different things. They should also learn about the history of medicine, moral practice. They should also understand the state-of-the-art technologies in the medical world: gene twisting, gene editing, big data, artificial intelligence, among other different cutting-edge technologies. They should also understand the legal boundaries of all of these different areas. This is going to help them to become the best medical students and the best or excellent medical practitioners. Thank you very much. With that, we conclude today's press conference of the Joint Prevention and Control Mechanism of the State Council. All of our distinguished experts has introduced the role of the medics played during the battle of COVID-19. We have witnessed once again the moving stories in the battle of COVID-19. I think no matter for the white angels warding off the virus or the practitioners working at their positions, the medics is actually getting the high price of the CPC Central Committee and the State Council. Recently, 4 of them is getting the award of the nation, and also they are getting the honorary name of the heroes of our nation, just as General Secretary Xi Jinping has marked. You are the commissioners of the future. You are the angel of hope. You are the loveliest people in this new era. So here, I want to congratulate on the 12,000 medical practitioners. Happy festival. With that, we conclude today's press conference. Thank you.